You've pointed out that 50% of the healthcare in Africa is provided by mission agencies, which is pretty astonishing. Particularly when you think, actually, to be fair, there's a lot of other people trying to help as well, but it's still 50%. What would happen? Because many people in yours and my culture would say, "Oh, what are these? Do we still have missionaries? Shouldn't we have got rid of them by now?" What happens if they withdraw?
They still provide a significant, faith-based or church hospitals still provide an enormous amount of the healthcare for Africa, variably put between 30 to 70%. So most quotes put it around 50%. So 70% of DRC's healthcare is provided by missions. So it's extraordinary, and that's counted by the number of beds that are provided to health. To serve the people. And it's the mission tradition. Hospitals, Christian hospitals, public hospital systems bore out of the Christian church way back in the Roman times when the Council of Nicaea said, look, we're going to have a place to treat poor people, sick people in every cathedral city. And so the sisters were also the nurses, so hence we call them sisters, from the cathedral. So
Is that where it came from?
Yeah.
The idea of calling nurses sisters?
Yeah,
I didn't know that. I've never heard that.
Yeah, so that's why they call they were the original out of the monasteries.
Is that right?
Yeah, that's right. So so out of the Christian tradition, the public hospitals started, and so as Africa opened up, missions went there to teach, to educate, to provide healthcare, to care, and so they're still there. And my organisation now, the Barbara May Foundation, is not strictly a mission, but it's very much faith-based, and we get a lot of our funding through churches, through like-minded Christian people to be able to do the work that we do. We also get funds from secular organisations, non-Christian organisations who trust and believe in what we do, and the government asks us to build hospitals, to develop their own health infrastructure in a particular area, to help train their staff, because they're making great progress. There has been an enormous amount of progress in the last 20 years with healthcare for a lot of these countries, but there's still a lot to do. And so it's still very much a partnership between the church and between the governments of these countries. And so if Christians are to withdraw, I can't imagine they would withdraw, because that's not the nature of Christianity. You serve and do the right thing. But if they were, that would still leave a huge hole in not only the health system, but also the education system for a lot of these places.